Hi everyone, good morning and welcome to our SGInnovate event this morning, Singapore time, on Future of Healthcare, Bridging the Care Gap. My name is Tuan from the SGInnovate team. We are a deep tech investor and company builder, and we believe in the power of science and technology to benefit humanity. We have been working closely with many deep tech startups and scientists to help them pilot and scale up deep tech innovations in AI, medical technologies, quantum technologies, autonomous vehicles, to name a few. And a big part of our work that we really like to do is to bring people together, industry experts, researchers, investors, scientists, and so on, at events like this so that we can all share knowledge, explore collaborations, and connect, even though we are now connecting virtually via a Zoom platform. And of course, everyone, it is very clear to us in today's COVID-19 world that technology plays a crucial role in enabling the healthcare experience. AI has actually been applied in healthcare to a very high degree, more than in many other industries. But that brings into consideration a lot of other factors, such as health data privacy, how AI could be explainable and ethical at the same time. So today, in our talk, we have with us Pierre Robinet, who is the senior partner and principal of health and wellness at Ogilvy Consulting. Pierre would be able to share with us his perspective on how the digital transformation in healthcare does not just rely on technological innovation, but also on the empathetic human element to deliver a better healthcare experience. Pierre is also the founder of a do tank, Live with AI, who aims to actually enable society to better live with AI moving forward. And SGInnovate and Live with AI and Pierre have actually been working together on many of these collaborations. And we are very happy to have more than 100 of us tuning into this session at this point in time. So without further ado, I would like to invite Pierre to start his conversation. Pierre, over to you, please.
Thanks a lot, Tuan. It's always a pleasure for me to be back here on an SGInnovate panel. I don't know if you can confirm you see my screen, that I'm now sharing my screen. I believe it's fine. So very happy to be with you for more than about 1 hour. We'll try to keep it short for my presentation because I would really like as well to keep some question from you. I believe like most of you, we are now at home. We need to completely change the way we work, the way we live. And I'm actually going to focus on what's going to change for the healthcare providers, for all those people who are actually on the front line and trying to really deliver the care we need right now during this crisis. And it's quite an interesting time because understanding what's going to change for them is going to really help us envision, how, any healthcare providers needs to change his overall transformation plan. So I am, as Tuan just introduced me, and thanks Tuan for the nice introduction. I am Pierre Robinet. I've been living in Asia for 4 years, working in Asia for about 10 years right now. It goes so fast. And I am a senior partner. Consulting is a consulting department from Ogilvy, the advertising company, and we mostly focus on digital transformation. And in addition to this digital transformation expertise, I developed a specific health and wellness practice here in Asia because we believe in the fantastic and tremendous growth of this category. We've realized how many clients, came to us to really reshape their value proposition, transform their business, and we needed to be expert in this domain. So this is something we started 2 years ago, and we got so much traction. And at the end of 2019, we decided to, produce a kind of point of view that I'm going to walk you through right now. Of course, this is a point of view that we've designed and produced just before this crisis. But I am very surprised, to be very honest, that every day I'm looking at, this point of view we wrote just a few months back. Everything is more true than ever because of this crisis, because of the situation we are facing. And I truly believe that everything that we are going to recommend, that we are recommending to our clients, is more true than ever. It's just going to accelerate. So now it's a question of how fast it's going to, this digital transformation will happen. But I am just impressed that every time, every day I'm looking back at those pages that I'm going to walk you through. And this is more true than ever. This is just now a question of time, because I think that after this crisis, yes, there will be a bounce back. I'm very positive about the bounce back. I can see, the light at the end of the tunnel, to be honest. I can see some of our markets have already started to, accelerate again, especially China. And I can tell you, we need to just go through the storm, but everything that you will see today is going to be more true than ever. And now it's going to get, be a question of like how fast companies will be able to shift their business, to transform their business, to really continue to win and provide the best care to the patient, to the consumers, because we are going to discuss a lot about care today. Something I would like to propose is I'm going to turn off my video because as a communication person, first, I do believe that it's always better to only focus on one piece of content. And I really believe that the content that I'm going to present you today is much more valuable than just my face. So I'm going to just turn off the video. That's going to really help you to deep dive in this content that I really hope you will appreciate. So let me just share this video right now so that we can get ready to discuss about the future of healthcare and understand a bit more what's going on and how any of those companies from this industry need to think about the future and need to accelerate their digital transformation. So basically, technology is disrupting healthcare just as it has so many other areas of life. New players, new approaches are proliferating, but while the changes may seem dazzlingly like diverse, I believe there is a single underlying driving force. This is the care, okay? And digital transformation in healthcare has many elements, we know. Tuan, in his introduction, pointed out some of them. AI and the notion of explainability. There is a lot of health data privacy question, IoT solution, but these are all valuable elements of the transformation. But what I really want you to capture from this talk today is they are steering to a single goal. And the single goal is really this empathetic care of the empowered patient. So more and more, and this is something that is certainly not new for a lot of you, patient need to be at the core for, the successful digital transformation. Patient need to be, at the center of everything. But what does that really mean? That means that a lot of, the healthcare stakeholders, so the pharma, the government, policymakers, the healthcare providers, the clinic, the hospital, the payers in Asia, which are very important, all of them would have to dramatically, redesign their entire strategy, considering what's going to change with the patient at the center. And basically, you could see that they would definitely have to embrace this kind of data-driven society, and their objective will be very different, because at a time, pharma will need more consent, for instance, to get more patient in their clinical trial. The government and policymakers would need to really pilot the data to envision what might be the new behavior changes foster. Healthcare providers would need, of course, to use the data to help patients adhere to their treatment, to their therapy. And insurance and payers would need, of course, to always deliver the best customer service. And I would say the big question for them is going to be the trust. So this consent, trust, adherence, and behavior change element would be absolutely critical for all those healthcare providers to transform properly, I would say, their business. And I think these are the core element of the way, what they need to consider to transform properly their business. So This patient at the center also finally changed a lot, how any healthcare stakeholder would just, redesign his business. And I think that outcomes and value will become the gold standard for the healthcare industry. All those stakeholders around the globe are looking for innovative, cost-effective ways to deliver this kind of patient-centric, technology-enabled solution to the patient inside the hospital or outside the hospital. But the core element of any digital transformation strategy is finally here, this shift to the outcome-based model. So what we need to do to better serve the patient? What kind of consent do we need to get to really better serve the patient? What kind of trust do we need to really get to better serve our customers if I am an insurance? What kind of data can I really leverage to help my patient better adhere to their treatment, which is definitely a key outcome here. And digital platforms and the growth of accessible data will facilitate this shift. But it's now down to the healthcare industry to really deliver on the promise. And the promise starts by really envisioning what is this outcome-based new model that you would like to propose to your clients, to your customers, to your patient. So let's start by a bit of understanding of this complexity, this complex ecosystem, because Asia is a very, very extremely diverse ecosystem. It's very diverse and different from population-wise. In terms of market access, I believe we have a lot of pharma players here on the Zoom, and I believe they know how, for those who are handling business regionally, they know how, the market access are different, between like Indonesia or Singapore or Korea. But we also need to consider that the complexity of that region is that healthcare resource, the healthcare resource investment and the money that goes behind any healthcare system across the region, and the percentage of the healthcare expenditures per GDP, of course, that are absolutely so different from a market to another one. And of course, very linked to this high income disparity. And people have absolutely not the same available income to really afford healthcare, therapy and medicine, which is quite complex to deal with as well as a company. And but this is just an overall view on this region. Something that is quite interesting as well, and that I got from my research as well on the Live with AI part of my work is we could see how the regulation in terms of data usage is very, very different from a market to another one. And we could also envision how the maturity of the data ecosystem, of the data architecture is absolutely very different as well from some markets to others. So that's really like make this digital transformation objective quite complex for anyone who is like handling this regionally here. I can see I already have a few questions, which is great. Don't worry, I'm going to absolutely keep some time at the end to answer a few questions that I will select after this presentation. So the first thing to know is that there are lots of healthcare opportunities in Asia. So this region is very diverse, but there are lots of healthcare opportunities. The rise of chronic disease, of course, urbanization, sedentary lifestyle, obesity have definitely ushered in Western style chronic disease. But on an Asian scale, population in the world with 114 millions of diabetic patients in China, 69 millions of diabetic patients in India, which is really, really huge. We have also a really, really like fast aging population, and we need to face with this aging population. And this is really, I think, a big opportunity for healthcare in the healthcare category. Not all at the same rate, but Japan, for instance, has a population, aging by 33%. 33% of the population will be over 60 very soon. So over 65s will be about like a quarter of the population by 2050, which is just amazing. If you look at just South Korea, this is the same. The proportion of those age over 65 is actually forecast to reach about almost 50% of the total, South Korea population in 2067, which really make them the fastest aging country in the world. And again, that will definitely open lots of opportunities. This is the reality. We will need to face this aging population reality. And last but not least, and something that very often people just underestimate, is there is a really, really big emerging middle class boom. So for instance, we expect that 430 million, the 430 million of emerging, middle class consumers in China will just boom to 780 million by 2025, just in 5 years, which is just completely crazy. And then there will be, a boom. The generation born post the 90s is definitely seen as the engine for consumption, with its combination of wealth, digital fluency, and their openness to the Western culture. They will become, this kind of, key opportunity target for any healthcare providers. And this will be really important to understand how to better serve them with the right care. And in the meantime, there are big challenges that we need, an hurdle that we need to overcome. First, I would say, because of this emerging middle class, there is a growing affordability gap. I, very often give the example that a vaccine, could cost about like 20% of the disposable income of an Indonesian, family from this emerging middle class. So imagine just, saving about 20% of your disposable monthly income to afford a vaccine, which is completely insane. But if you just look at other therapy like oncology, for instance, a cancer treatment could cost up to like 100 times the price of the house of a Filipino from this emerging middle class. And this is really a big problem across the region. So a huge growing affordability gap that any healthcare providers would need to consider. And I would just touch this question afterwards with specific recommendation on how to tackle this affordability challenge in the region. But I would say another key challenge here is the hyper access to the information. Patients know everything before just entering in the doctor's room. They proactively manage their healthcare journey. And this deep fake news and misinformation in healthcare, especially, for instance, in the vaccine space, but I would say for any, therapy. And this is quite complex to deal with, because such problem when you are a healthcare provider, because you would need to reassure that what you are, this transparent, you would need to reassure that you are the trusted source of information. You would need to just empower the doctors so that they can be this, continue to be this trusted source of information, especially at a time, where people are more at home than ever, and are going to dramatically change as well their behaviors towards this healthcare ecosystem. I have voluntarily not included here anything related to this COVID situation, but you can envision that, of course, our behavior is changing every day. My wife just yesterday went into a telemedicine platform because she needed to get in touch with the doctor. And basically she got like very good advice, and this is going to change her way to, get in touch with the doctors. Like many of us will definitely change their interaction with clinics, with insurance, with pharma companies in the next few months after we will, just get out of this crisis. So for big opportunities across the region, absolutely key challenges as well that we need to consider. Now there are winning strategies, and I would say they are more true again than ever. And I will just walk you through these kind of 4 pillars and 4 winning strategy, and I would be absolutely very happy afterwards to take any question. So 4 winning strategy, the first one is we need to bring, to design more compassionate and empathetic experience. because this is crucial, because that's going to help any company create the difference. The second point, and we will discuss data. You know that I'm passionate with data. I've done my own research on how data can really help us get a better life. And I believe in the value of data and machine learning and artificial intelligence system to really improve our healthcare systems and help us, by the way, to design such compassionate and empathetic experiences. We will discuss about, you know, the need to embrace the retailization and the consumerization of healthcare. Some of them have started. Most of them are the digital giant, and I would recommend to any others to really like catch up very soon. This is absolutely critical to continue to win and continue to engage strong relationship with any consumers, any patient, especially after this crisis. And of course, I'm going to touch a bit to this affordability challenge. And I could really like speak during hours about this challenge, but I will just try to give you a few tips about like how to start in tackling this challenge here in the region. So, but let's start with this notion of care and this notion of, you know, caring for the patient. And I think this is really something where I would like to have a pause, because this is something certainly more true than ever that a lot of people really very often forget. If you see how our system of care is at stake today, if you see finally how care is no longer a guarantee for everyone, if you see how all over the world, you know, care is, you know, in any mouth, care starts to really have a central position across, you know, the world, especially because of this COVID crisis. And I would say that this notion of designing, you know, the best empathetic care experience, the best compassionate care experience for patients, for consumers, is more true than ever. So I like to say that, what does that mean, you know, empathetic care, compassionate care? I like to say it's about thinking about really how to provide the most, you know, the holistic care a patient would need. A patient, you know, suffering from Parkinson, for instance, is not only caring about his tremor, is not only caring about, you know, his physical disabilities, is also caring about anything that he will not be able to do in his life. He needs some mental support. So as a healthcare providers, how can you just give to the patient, to the consumers, to your, you know, patient and customers, the care they need holistically, not only thinking about the physical care, but also the mental care, providing them all the support they would need to really go through the disease, to really recover well, to be able to really adhere to their treatment, to continue to finally manage their well-being, and their health, because this is how you will help them better than the others. So there are a few examples and good examples of this kind of new compassionate and empathetic experiences that matter. A very good example that I like is the one from Migrant Buddy from Hillind, a Singapore-based startup. They have about 1.8 million of migraine sufferers using the platform to track their condition from symptoms, triggers, medication management, you know, and they can receive like from fellow sufferers, like through the community message within the application, any kind of support. And it's really like, you know, this kind of new platform that patients are expecting to get more and more. And what I like is like, you know, when Novartis realized the importance of such an online community platform, then they decided to undertake this partnership with them so that they could integrate a coaching program and disease education campaign to help patients, you know, manage their migraine more effectively. And for a pharma company to anticipate, you know, go to those communities and try to see how to, you know, enhance this platform and community to deliver a better care. But compassionate and empathic care is also about, you know, designing well thought and holistic program, meeting the Asian needs. And this is something very important because especially in the healthcare space, a lot come from outside, a lot could come from the US or from Europe. And I believe are connected to some headquarters in London, France, the New Jersey, Switzerland. And sometimes they would really need more like local insights to really like propose a nice experience to their patient and consumers. And this is a really good example here from AIA, who decided to roll out a sleep challenge initiative under their Vitality program in Singapore. And just because they know that for Singaporean, this is something that would be very culturally well accepted. And this is how they could finally provide a very good wellness, empathetic program by being completely anchored in the Singapore culture, in the local insight, and ensure that, they will deliver something that matters to the local population. I would say this is also more true than ever if you consider diabetes. But diabetes is a lot about nutrition and managing his diet. You would need to adapt your diet program, your diet support, if you want to offer this to patients, to their local diet, to their local habits, because this is the way you will engage better with them. And finally, there are also ways of looking at partnering with, advanced medtech company to continue to equip the caregivers with the right tools so that they can provide adequate patient care. And I love this example from Novo Nordisk, just as partner with Flex Health to launch the first connected insulin pens to market, providing both patient and caregivers with the ability to monitor, the insulin dosage, but also the schedules. And it's a very nice way, to really anticipate the new support, daily support a company can offer to its patient on a daily basis. So to design such compassionate and empathetic care, and so I just gave you a few examples, it's very often important to consider partnerships. And this is something I truly believe can help accelerate. Sometimes, people just want to do everything by themselves. I continue to strongly believe we are in an open world where partnership would matter more than ever. And this is a framework and a pyramid that we are using very, very often to help our clients, looking after the partners that definitely will help them reach these, compassionate and empathetic objective, to differentiate strategically, to go to market, through the right channel, through the right key opinion leaders, but also answering foundational elements, the needs, the wants, so that are absolutely important. So this is just an example here about, some themes that, any company would need to just focus on a theme that will definitely be the one where they will have more permission than the others. How to leverage partners, how to leverage key opinion leaders, patient association, policy advocates, how to go to universities, center of research, partnering with the new platform, the one who are actually more and more leading the e-money healthcare agenda across the region, because they are extending their offering. So Grab has, already entered into healthcare. Line is already entering into healthcare. Gojek is certainly the first platform who entered into healthcare with their GoMed solution that I think just started a few years back. Partnering with hospital, partnering with coalition. For instance, the KICS coalition for the cervical cancer in Indonesia, the MSD Pharma did a fantastic work partnering with KICS. To consider to really design, the best experience for their patient, for their consumers, for their customers, and thinking about delivering the best compassionate and empathetic care, not only just thinking about the physical, element of the care, but, the holistic, providing a holistic and looking beyond the pills, of course, for the pharma. This is something you certainly heard about very often. Then the second point is really about data. And, when you look back at what happened in pharma and in healthcare for many years, it always has been about physical data, blood glucose, cholesterol data, heart rate, signal data, ECG data, blood pressure. This is mostly, what doctors, physicians will look at. But if you really think about this notion of compassionate and empathetic experience, it's worth exploring, the data for, required for such empathetic care, and really looking at the cultural and human factors that will help you to be really truly patient-centric. So how to understand patient emotion, how to get access to psychological cues, how to really understand our cognitive biases or our behaviors, which is again so true today. How Europe could have anticipated this crisis situation, they were not just prepared, but they were, so much biased because they were just too optimistic. And the optimistic bias is a very, very well-known bias, especially for people working in the vaccine category, because just people believe that a disease can't never happen to them. Understanding of bias, understanding emotion will definitely be a critical element to design this empathetic and compassionate experience that will make the difference. So it starts by mapping the opportunity differently. If you want to just look at where are the opportunities across a region, just don't try to focus only on how much market share you can get looking at the size of the market. Don't try to look at, how many people you can just, treat or you can help based on social demographic data. Try to go deeper and understand what will make this market so specific, what people would really need, how people are relying on the social norm, for instance, how people are biased, so that you can understand where are the biggest opportunity to start, in which market. And I can tell you, having done some research, we identified, I remember, on a specific therapy, two, market size absolutely similar between Indonesia and the Philippines, but understanding behavior elements from both the Filipino and Indonesian towards this specific disease made us just take the right decision, because the bias in one market were much higher than the other one. It's also important to democratize data and start empowering anyone. And I think the best example is the one from Pfizer, their cloud-based virtual analytics tool that is enabling employees from diverse divisions to just collaborate on finding undiagnosed patients of rare disease. This is just beautiful. There was a person from Pfizer who said, and I want to quote him, while data science is a critical skill set in our company, you don't need a mathematician or data science expert to use it. Anyone needs to now play with the data. Anyone in the company needs to finally be able to leverage data. Always, having in mind, how can I participate myself as an employee to deliver this better, compassionate and empathetic care to my patient, to my consumers, if I am working in an insurance company. And of course, and this is something where I could just speak for hours, there is a need of managing consent and create new frameworks. Data privacy is something that is more important than ever to consider in the healthcare space. New frameworks and governance model are needed, especially because we will see the arrival of wearables and their acceptance as part of illness prevention, for the population. Data, AI, machine learning will create more great outcome, including pattern detection, automatic treatment recommendation, but we need to ensure that there are no bias in algorithm. We need to ensure that health data are protected. We need to ensure that we have the right system in place. To make Holy Grail, and we need to think about decentralized model and safer sharing to just be able to share more data across markets and across different departments and units from the organization. And I truly believe that's going to really accelerate as well the change and the transformation of clinical trial. At the moment, we can just better manage patient data. Now, just also something important, it's time to consider how these category is changing, and we need to embrace more the retailization and the consumerization of health. There are multiple examples across the region. Medical service on the WeChat messaging platform, Hello Doc, Hello Doctor, Gojek, are all providing now healthcare services in Indonesia. DocDoc using a powerful AI model to match the unique patient need with the unique doctor needed by the patient. Telemedicine platform are actually booming. Last week again, Doctor Anywhere raised 27 million in Asia in such a crisis moment, which is absolutely fantastic. And it means that a lot of healthcare companies would absolutely need to anticipate that shift. And a few things I would recommend is, the first of all is consumers, patients are expecting to get a 24/7 availability of the services. So the hospital chatbot, for instance, from Mount Elizabeth here is a good example. How can you just deliver what people want? They want a 24/7 service. They want you to be always there with them. And it's really a start in, creating this compassionate and empathetic experience they are expecting. But this is also about, including new channel, new partnership to improve your omni-channel strategy and engage those patients along the care journey. There are a marketplace distributor finding new opportunities and offer, better option for patient. There is a good, example of this healthcare provider, White Coat, enabling e-consultation with a GP here, and that following the diagnostic and prescription, patient have, the ability to get their medication sent to their home through Grab Express within 90 minutes. This saves times, this reduces the stress, these offer a sense of reassurance, these help to finally provide this compassionate and empathetic care. And again, it works. This is today, this is not the future. Just again, my wife yesterday went onto this platform and got a medicine right after 1 hour through Grab. And this is something which is not going to change, because that's the way people want to live. And because we are also embedded within a creative agency, I believe in the importance to consider more and more virtual care and leverage creativity. And I want to only show you one video that highlight this point, how to consider virtual care to improve the experience for patient, for HCP as well. On a very, very good topic that I like so much, this is the pediatric vaccine topic. And I believe some of you have children and know and have experienced how tough it is to go to the pediatrician to get your children vaccinated. So just imagine how it could change your experience. Just watch this video, I'm sure you will like it.
This is VR Vaccine. The VR vaccine is an immersive adventure where the children become a hero about to receive a powerful shield. To make it work, we need one VR gear, one smartphone for the children, one for the nurse, and the VR vaccine app.
Oi! Você voltou! Você voltou!
And what the children experience in the virtual world is matched step by step by the nurse that follows the story on a second screen.
Pronto. Agora o fruto de fogo. Mas ó, vamos lá. Bem rapidinho. Peraí.
All simultaneously calming and entertaining children while helping the nurses to better perform the vaccination.
Funciona, funciona, funciona! Obrigada, obrigada! Caramba, filho, o que você acha disso?
E na hora da vacina, ela faz uma relação ao calor. Nessa hora, ela sente a picada. A picada é dentro de um contexto.
Cada vez mais, a realidade virtual se torna uma grande aliada da medicina.
So let's just focus now on the fourth topic and main pillar that is certainly the one that I'm the more passionate with, is how to ensure that we can tackle this affordability challenge. This is dramatic. There is a lack of insurance coverage in Asia. This is a major challenge in Asia Pacific that plays a huge part in the healthcare protection gap. Public reimbursement can subsidize some treatment, but they don't do enough to reduce this financial burden for new therapy. And pharma companies have already tried to bridge this gap, discounted, volume-based patient access program, promotion. But the reality, it's not enough. It's the shared contribution model or the patient access program is the most common program in Asia Pacific. But while several disease-specific outcome-based insurance and financial program are emerging in the market, but we need to see how to go beyond that. We need to see how to really tackle this affordability challenge, and at any level, and try to go as deep as possible in the emerging segment of the population, because these are the ones who are certainly the less covered and who need such solution to get empowered and finally get more access to the care, get more access to the treatment, get more access to coverage, get more access to long-term treatment and long-term care support, and get finally more access to these compassionate and empathetic care experiences, which are going to cost money. And I could see some question about the economic impact. I'm going to take that question afterwards. So basically, this is a continuous challenge, and to really answer this affordability challenge, you need to really understand and look at what are the key questions you need to answer. From the moment you need to raise awareness about the disease, the moment where people need to think, just consider that they may just go to the doctors or just get an appointment, the moment where they go to the doctors, the moment, they are in the treatment or after the visit. And if you really want to, identify, tackle this affordability challenge, there are three things that are important. You need to identify the coalition partners that could really help you, at the awareness stage, so that, people could really, use toolkit for hospital clinics, just find the right clinics, find the right doctors, identify how to facilitate the access to this treatment, and then identify the options so that they could really better financially, afford the treatment. But what people really sometimes forget is that tackling this affordability challenge is not only tackling the, the ability to pay challenge. It's important to consider that we need to tackle as well the willingness to get treated challenge. If people are not willing to go to the doctors, if people don't believe that this treatment or that this kind of, treatment will help them in their therapy, they are even not already at the stage where they should just consider that they need to pay for this care. And this is something that is really important, because most of the time just people start looking at what kind of financial solution they can put in place, but forget that they need to really work on this willingness to pay, willingness to get treated. And both elements are critical to win in this big affordability challenge. So there are multiple examples, and I could spend again hours on explaining the different model. The first one is reimagine to the insurance model with outcome-based approach. There is a very good case from China and the Shanghai Pharma and Weite Insurance combined to create what they call the Mexin plan. And they have a specific therapy that has 95% of success rate among hepatitis C with a patient having a certain genotype. So eligible patient were insured for low rates, but they were required to upload test results monthly to ensure compliance. And if the outcome was not favorable, the insurance were able to compensate. And if patient drop out the treatment cycle, they forfeit the right to claim. So this is an interesting, kind of partnership between insurance and pharma. More partnerships than ever. It's time to look after, partnership with non-profit, to try to, cover a part of the cost. It's also, important to start looking at how to come together to lower the cost of the treatment And because finally, this is a way to provide a better care at a lower cost, at least to divide the cost together with a medtech, for instance, or together with a partner. So a good example here is, patient with chronic disease. Really, really huge, especially for type 2 diabetes patients. They don't only require medication for treating the diabetes and their comorbidities. They just also need, special diet, the regular clinical diagnostic step. They need to really be in touch with the platform every day. This is where a partnership between drug manufacturer, insurance, medical facilities could really help to, decrease the cost, share the cost of this disease management to ensure that finally this is not all the cost for the patient at the end. And of course, I would say certainly the easiest one to implement, and I would recommend to anyone, is it's important to consider more staggered payment and load solution. So the example that you can see here is a specific solution we've put in place in Indonesia, using Blibli and Allodoc to finally offer to people first a consultation so that they can go to see a doctor and get access to a specific loan and staggered payment using Blibli without using the platform and the Gojek environment. This is certainly one of my most exciting projects, and I think we need to do more of these type of things. All those new platforms are actually offering, to any brand, any companies, the ability to design such compassionate and empathetic experiences. And now it's really more important than ever for brands and healthcare providers to think about this financial element at some point, how to be here when the patient, when the consumers need our help financially, just by staggering a payment over 10 or 12 months, just to decrease the cost of the burden on the emerging middle-class family when they just need to afford a treatment. So of course, this always be, it's easier when you are considering a vaccine, when you are considering vaccine or diabetes treatment, than it is for a high cost, therapy like cancer, oncology treatment, which could, as I said before, cost about 20 to 50 times the price of the house of an Indonesian or Filipino person. So these are kind of 4 big wins and a winning strategy that I think are very, very valid. And we are actually, deep diving in all those elements, looking at how this is going to continue to accelerate regarding to the situation, but that situation we are facing today is definitely going to ask for much more compassionate and empathetic care. I would say people are now resilient. And I would say how, healthcare providers will need to anticipate that resilience is certainly the next big thing. Making data human. We see how Trace Together has supported Singapore in tracking the virus. This also raises a lot of data privacy issue in Europe, struggling with their GDPR and their different views on the way we need to regulate data. So this making data human will be more true than ever. I would say we have already entered in this new retailization and consumerization chapter, and it's now urgent for any healthcare providers, from insurance to pharma, to think about this retailization, and of course tackling the affordability challenge, especially after this crisis, where a lot of people are going to suffer more and more, would have lost their job and would need. I'm going to take just a few questions. Just wanted to finish on a big thank you for having listened to this. I think we still have about 10 minutes, so I can pick up question. If you want to reach out, please feel free to reach out, send me an email. And this is something, as you could feel, I'm absolutely passionate with. I do believe there is a massive opportunity for any healthcare providers after this crisis. I could really see the bounce back will arrive very soon. I could really see a lot, of brands and business would need to now take the decision to accelerate that shift, but also, anticipate how the consumers, the patient behavior will change, because this is really what's going to make the difference, is how to get out of this crisis by anticipating the new consumer and patient behaviors you would have to face in 2 or 3 months ahead, to be ahead of the curve, to provide this compassionate and empathetic care to those new people, to those people who will have changed their behaviors. So let me now open the question, and I have so many questions here. It's a super nice question. I won't be able, of course, to answer to all of those questions. I'd like to just answer this one. So if you could see this one. So do you foresee that the move to be more tech in healthcare will save money in healthcare for both the individual and nation in the long run? This is a very good question, and thanks for sharing. I'm not sure I have the truth in my answer. What I really think is we absolutely need to, I'm going to maybe open my video again so you can see my face now, because I'm just speaking directly to you. I think we would absolutely need to envision the outcome-based model, the new outcome-based model I was mentioning in my introduction. And I think this is critical to start from there. And at the moment you define the outcome, you should be able to define with very specific KPIs how you want to track this outcome. And I think what really people miss today is this alignment on the outcome, especially between any healthcare providers and the government. And so getting an alignment on the outcome and being able to track this outcome with the right KPIs that serves anyone's need, I would say. So a government, for instance, wants to absolutely see the decrease of the burden on, and how to decrease the healthcare expenditures. But that finally could only happen if people change, for instance, their behaviors towards a specific disease. And the notion of the behavioral change is certainly most critical than ever, because the way people behave will definitely dramatically impact, the end outcome and at the society level. And in the meantime, these are very long-term goals and long-term objectives that needs to be tracked and measured. In the meantime, pharma company or healthcare providers or insurance who are actually helping to reach out to this outcome need to ensure that they are tracking some key steps to reach this outcome and tracking, short-term results. So anyone needs to track his own, indicator, but we need to get connection between all those indicators so that everyone can come together to serve the long-term goal. So how can we, so the question I think is how might we help any of these healthcare providers, insurance, pharma, or government to align on a long-term objective that also take into consideration any of their business short-term objectives for any of those participants to the long-term plan. Because independently, pharma can't do something by themselves. Insurance can't do something by themselves. What makes this, I think this a complex question is how all together need to finally act as a one team to really provide the best outcome, and again with the right tracking. But at the end, yes, I think we could save money. The problem is we need to really align on the KPIs. We need to align on what do we want to track to see how any of those people save money business-wise, and in the meantime, how this has an impact on how the society saves money, and in the meantime, how the people will save money, because this is really something achievable. Let me just take another question. So maybe this one, I understand about making medical tech more compassionate and empathetic as I consult with engineering students who develop apps to help patients of diabetes, dementia. Do you foresee that in the near future we will have an app on diabetes, one on dementia, one for each type of cancer, etc., to provide knowledge to patients? That is a very good question. I do believe that anyone is actually expecting to get more personalized experience, whatever is the experience about. So I think we should move to the fantastic segment of one chapter, how to deliver that experience to any individual. I am not sure that we should happen within specific closed environment, and this is why I don't like to use the app word or notion. I think it's a question of addressing those individual. And I believe that we would need some very strong, experts to work on this content so that the content could really fit with the physical, mental needs of those patients, managing their own therapy, their own disease. So I'm not sure we will get a one app dedicated to diabetes. I think we will get multiple kind of pieces of content that would need to be addressed to any of those individuals along their care journey, along their disease management journey, to always serve their needs and be there, with them to provide them these compassionate and empathetic, personalized care experience they are asking for. This would be my answer. I think we are 2 minutes left. Yes, Shamin, the deck will be shared, I think. Dan, thank you for asking this last question. I agree such technology will be costly, and how does this development cost going to recoup back? Again, I think the big question today is how to really get an alignment between all healthcare providers for a short-term, mid-term, and long-term impact that needs to serve anyone's needs. So government have a need to decrease the burden on their society and the financial burden. Pharma companies have their own business needs, which needs to be just understood. Insurance company have their needs. So anyone has a need. And I think we absolutely need to help them come together, align on this long plan to provide the best outcome-based, model and experience people are expecting to get. I think we are just in time. For me, I was really, really happy to just have this moment with all of you. I could see we had almost 200 people attended, which is fantastic. Again, thanks for connected today. Thanks. Reach out if you need anything, and hope to see some of you very soon in the real life, because I know that I spot a few names I know very well. Thanks a lot to Tuan for your trust. Thanks to SGInnovate. It's always a pleasure partnering with you and getting that time with your community of extraordinary people here.
Likewise, Pierre, we have received a lot of comments from our audience saying that it has been a very, very insightful session and presentation, and they thank you on behalf of everyone. I would also like to thank you for spending time with us this morning. And with that, please feel free to contact Pierre through his email address that he has shown at the end of the presentation slide, should you have any further question that you would like to discuss with Pierre. And once again, on behalf of everyone, I would like to give you a good round of applause for the session today. Yep, everyone else can't do that, so just let me do so on behalf of everyone. And thank you, Pierre. Thank you, everyone, for joining us this morning. There will be more sessions on the topic of healthcare as well as explainable AI that we are lining up in the coming weeks. So do join us. Until then, please stay well, and thank you again, everyone.
Stay safe. Bye.